Good morning, everybody. Good afternoon. Let us start with this 10th session. That is the latest session that we have foreseen in this session. Deals with the mechanisms that could be in place for launching, implementing, coordinating, monitoring, and evaluating a national program on occupational safety and health. In this session, basically, I will bring you some of the experiences or some of the directions that the ILO is giving for this type of activities. Basically, I have included some of the experiences of that different countries have chosen for these operations, for these activities. So in these presentations will take 1 hour, included also if you have any questions or any comments that you may want to share. For your information, if in any moment of the presentation you want to make a question or a comment, please feel free to interrupt me. I mean, just raise your hands and we will give you the floor. So it will allow us just to interact in an easiest way. Let us then start with this presentation. Okay. As other presentations, you will have it in the platform. Let's start with the launching. How to launch a national program on occupational safety and health. Well, there are different ways. A very common thing is to wait for a particular date. For example, some countries have decided to launch the National Program on Safety and Health the 28th of April, that is the OSH day. So it is a good date for launching because normally you have a public that is commemorating or celebrating this Safety and Health Day and will be interested in knowing what are the activities or what are the objectives of the public institutions on occupational safety and health. Another thing that is also relevant is who is involved in this launching. Is most of the cases, the launching of the national programs is made by the Ministry of Labor, that used to be the competent authorities in most of the countries. But there are the cases in which it is decided that to deliver kind of this announcement or this launching of this program, bringing the most, the representatives of the most important workers and employees organization together with the government institutions. There is one case, for example, I remember in Thailand, in which this launching was made by the Prime Minister. It's also something that can be of relevance, because when there is the Prime Minister who is doing that, you can ensure that there is a coverage of the media on what the Prime Minister is doing. But it's not simple just for people from the Ministry of Labor to be included in the agenda of the Prime Minister. The important thing of this launching is that you will provide visibility to the national program, but at the same time, you also show a strong commitment, because you are making public what are the objectives of your government. And this is something that you share not only with workers and employees, but also with the society and safety and health practitioners. Here you have a quite interesting example in this slide of the from Australia. And in Australia, they decided to have a document that they have called a Statement of Commitment, in which the Federal Minister for Employment and Workplace Relations signed it, together with the ministries of labor of the different provinces and territories of Australia, because in Australia they have competences, all the regions or all the provinces. Also, the head of the Australia Chamber of Commerce and Industry and the Secretary General of the Australian Council of Trade Unions. In this way, you are showing that this national program is not just a government initiative, but it's also a initiative at the national level in which social partners has been included. This is an interesting way to provide this launching. When you want to make a communication or campaign or launching the national program, you have to decide to make yourself these questions. Which are the target groups that you want to reach? What is the level of detail or specificity that may be required for each target group? And which are objectives you want to achieve with this communication campaign? And above all, it's also important to see how much money or how much resources we have for doing that, because at the end, we can do depending on the resources that we have. So some of the most common target groups for a communication campaign of the National Program on Safety and Health is public officials involved in safety and health specialists from private companies, workers and employers, mass media, or general public. This could be the target groups. The ways or the channels or the methods through which we can do this communication campaign could be simple information offerings or some detailed guidance. Probably if you want to inform or to communicate to people involved in safety and health, they will be expected more detailed information than just some relevant headings. General public of media probably will be interested in simple information. You can decide to do this communication through conferences, training sessions, or campaigns, or you can do it through the media. Here you have, for example, one option that is very common. Most of the countries, what they do, they prepare a web page in the main, in the website of the competent authority on safety and health. For example, here you have an example from the Danish Work and Environment Council, in which they present the national plan, and not only present the national plan, but also they upload periodically. They were uploading periodically the reports that of the reports of the progress that they have had in this national program. So this is something that could be also an interesting initiative. Another ways is, for example, in the case of Australia, they have they create a paper, a brochure in which they inform it on what were the vision, the targets, the indicators of success. These also, many of the countries, they have this approach. For example, also New Zealand, also Singapore, they have produced a brochure with information regarding the national program on occupational safety and health. At the same time, of course, to implement the national program, you need to have plan of actions. This plan of actions should be built on the national program, on the strategic plan of the national program, should be aligned. I mean, if you have some goals or some specific objectives in the national program, the activities that you do should be aligned just to achieve these goals, these objectives. And you should understand the logic. I mean, if you have a look to the activities that you want to do, you should understand how these activities will help you in achieving that the goal. So this is something important, because sometimes you see from one side, you see the goal or the objective of the national program, and when you see the activities don't match very well. I mean, you don't understand how they will achieve this objective if they are undertaking some activities. So the activities should be drafted for reaching the objectives that you have indicated in the strategic plan. I wanted just to bring to your attention the fact that when you are planning, what we are doing is, in some extent, looking ahead of our future on what we want to achieve, what should happen in the future. This is the planning. Planning is when we have a plan, is what we are expecting that will happen in the future. The evaluation is totally the opposite. Basically, the evaluation is looking back on what happened and to be if it was aligned with the plans. So basically, we compare what happened with what we're expecting to happen. And then we have other kind of operations that are called monitoring and control, that is an ongoing looking. While we are implementing the activities, we need to continuously monitor if what we are doing is what we are planning, and if what we are doing is producing the results that we were planning. So monitoring and control is, there are operations. Monitoring basically is an operation to collect information on what we are doing, and control is an operation is how to implement corrective actions in that moment to make sure that what we are doing is aligned with which we are planning. So this is just to illustrate it. As mentioned before, monitoring and control, they are important, very important operations during the implementation of the activities in the program. We monitor to be sure that the performance follow the specifications set in the planning, that activities, actions are operating effectively, and we are reaching outputs. We use monitoring to identify eventual errors of mistakes. And mechanisms of control is, once we have this information, what are the corrective actions that we should adopt? This is very common for everyone that is in the process of implementation of activities. You have to collect information on what is happening and adopt corrective actions. Sometimes this monitoring, most of the times, the monitoring is made by those that are doing the activity, because they are the ones that can easily take measures to correct and follow the specifications of the planning. However, there are when we are implementing a national program, sometimes there is kind of a committee or a commission that is in charge of the assessment, the progress of the national program. For example, in some countries, they have a National Commission on Occupational Safety and Health that are the one that has adopted this national program on occupational safety and health, and also have duties on assessment the progress. It means that they want to receive reports periodically from the institutions in charge of implementation that they are following the plan or not. And this central coordination body or national committees may decide to adopt corrective measures if, for example, if the activities implemented are not following the calendar, or they have faced one problem, or etc. So when we are talking about monitoring of the activities, we are talking about, for example, some actions that those that are implementing the actions of the National Program on Occupational Safety and Health are doing, but also sometimes when there is a central coordination body or national commission on safety and health, they decided that they need to be informed on the progress of the national program, and they decided any corrective actions. So these are, let's say, different levels of monitoring. One of the important things is that when we make the national program on occupational safety and health, we should also plan how or in which way the monitoring of the program or the evaluation of the program will be done. The monitoring and the evaluation, even if they are done during the implementation of the program or after the implementation of the program, you shouldn't wait to those moments to decide how to evaluate or how to monitor. They should be planned in advance. For example, you should decide when you draft your national program how often the performance information will be gathered. What type of information you should provide to the decision makers. When you have to provide this information and how much it will cost. I'm telling you this thing of how much it will cost because if we have, for example, a program of, let's say, 5 years, national program of 5 years duration, probably to create a system for reporting every 6 months is too much. It means that you have to report 10 times in a 5-year period. It will be a little bit too much, and it may be too expensive too. So these are decisions that should be made. Same thing when we have to plan the evaluation. We have to decide what is the frequency of the scope of the assessment, the methodology of the assessment, what we are going to evaluate, who will be in charge of evaluate, who will be the team in charge of the evaluation, and in which way or through which mechanisms we will report. All these decisions should be made at the same time that we are developing our national program on occupational safety and health. For example, you have here some examples from Australia, Denmark, and Finland in their national programs that made these decisions. What are the evaluation intervals? For example, in the program of Australia from 2002 and 2012, monitoring of strategy implementation and performance every year. And every 3 years, they will have a triennial review of the strategy. So these are the timing for the evaluation and monitoring. For example, in the case of Denmark, they decided every 5 years to have an evaluation, but there are some activities that that in the national program that involve interventions in the enterprises in which they were expected for a triennial review. In Finland, they also have every 3 years In Finland, they have a 10 years program, and every 3 years they have this evaluation. And remember that also, for example, in the United Kingdom, the revisions were made every 3 years too. Who was the company or who was the entity that decided or contract the evaluators? You can see that most of the times they were or the National Ministry or the National Council. The National Council normally are a tripartite body who was monitoring or who was checking or promoting this national program on occupational safety and health, or the ministry, the competent authority. They are the ones that contract the companies that will evaluate the program during these periods. The contractors, so who will do the evaluation? For example, in the case of Australia, they decided to ask the Australian Safety and Compensation Commission. This is a body, is a public body, but is independent of the. Is not the same body that implement the national program. Because if you want to assess or to evaluate the national program, it's better to ask someone else that is not involved in the process of implementation to evaluate. So they decided to ask to this Australian Safety and Compensation Commission to do it as well as an independent consultant. In the case of Denmark, they asked for labor inspectors, private and public and scientific institutes for these duties. And in Finland, they decided to do it, the actors themselves and public institutes. The actors themselves, they mean workers organization, employers organizations, and other public institutes. And through which methods they will evaluate? Analysis of data and interviews in the case of Australia. In the case of Denmark, also analysis of data, interviews with specialists, company visit, because in the case, some of the objectives in the case of Denmark were reducing the number of accidents, reducing the exposure to hazards. So it is required to visit companies. And in fact, this is the reason for which labor inspections were involved in this evaluation, because some of this information was collected by inspectors visiting the countries. An important thing that we will come back later is the use of surveys. The use of surveys, basically, a survey is kind of a questionnaire that you can make to a representative number of employers or workers in which you ask them for their opinion or for their to expose their situation. Sometimes surveys are very good instruments when you don't have other kind of data. For example, in some countries, when they didn't have information about what are the mental the mental problems that workers may have on occupation related with their occupational exposure, because in many countries there are no mental diseases recognized as war-related, so they don't have other ways in which they can collect data on how workplace may impact the mental well-being of the people. What they do is these surveys. I mean, they decided to make a survey for, let's say, 3,000, 4,000 people, a number that could be representative of the workers that you want to study, and ask them, I mean, do you have any problem of this kind that could be related with your workplace exposure, etc. So surveys could be a good way in collecting information when you don't have other methods. Also, Finland, they are using the analysis of data, surveys, and interviews as a means, as a method for evaluation. Why we are using evaluation in the national programs? Because it's necessary to have or to adopt an approach that is based in the evidences. So there are different ways or different types of evaluation, and as mentioned before, it is important to decide what type of evaluation you want to undertake. One is the summative evaluation, is in which extent the program outcomes has been generated as planned. This is, in any case, this is something that is very necessary. So this type of evaluation always need to be done. If what we are doing, the activities that we are undertaking, produce the results that were planned in advance. Second type of evaluation is the process evaluation. The process evaluation is in which extent the program operated as intended. Here, in addition of evaluating the outcomes, if the outcomes were the ones that we were planning, we also evaluate the type of activities that we did, the resources that we have. So collecting information not only of the results, but also on the type of activities that we do, the resources that we have, it will allow us to understand why the things work well or work not so well. Because when we only evaluate the final results, we only know if the things were good or not, but we don't know the reasons for which the things were not working well. When we evaluate the entire process, we identify, look, maybe results were not achieved because we didn't allocate enough resources, or we didn't perform the activities, or the activities that we performed were not adequate, or we should develop more training, more activities of this kind. So this process evaluation is also very necessary also to generate information on how to improve in the future. Impact evaluation is also quite important, whether the program actually meets the goals. So normally this impact evaluation is something that is assessed by the National Commission or the National Tripartite or the National Coordination Body. They decided if the impact that has been achieved by the program is adequate or is in line on what we were expecting. What are the parameters that we will or we could evaluate? Here you have the definitions of some of these parameters, but I would prefer to show you in this graphic. For example, imagine that you have the national situation of your country. You analyze this national situation, and based on this analysis, you decide to adopt some goals in the national program. The relevance of these goals is if these goals are relevant, if the goals that you have decided to include in your national programs are relevant to improve the national situation, or they are not so relevant. Maybe you have not chosen the right priorities and your goals are not good enough. So the relevance is an important thing. Another thing is that once you have identify your goals. You have allocated your inputs. You have performed your activities, training, inspection, whatever activities. These activities has produced some outputs, some results, and these results have some consequences on the occupational safety and health situation. When you compare the goals that you formulated in your national programs with the consequences, with the outcomes of you have produced through the implementation of the national program, you can measure the effectiveness, in which extent the program, the outcomes of the program has achieved the goals. This is the effectiveness of the program. So if you achieve all your goals, we can say that your program has been very effective. They have achieved their goals. Another parameter is the efficiency. The efficiency basically is how well are you using your resources, your inputs, in generated outputs or outcomes. Sometimes you do not achieve your outcomes, you do not achieve your goals, but you are very efficient. You are using your resources, and with the resources that you had, you did the best which can be done in that particular circumstances. Another parameter is the impact, in which extent the goals, the outcomes that you have achieved after implementation of the national program has changed the national situation in occupational safety and health. And another thing that is also relevant is the sustainability. So maybe you have an important impact in the OSH situation, but it is not durable. It doesn't last too much in the time. So an intervention is sustainable when the effect of your change or your impact lasts over the time. So this is also very important because maybe you have some interventions have been successful, for example, in some companies in reducing the number of accidents and diseases. But after 3, 4, 5 years, the number of accidents rise again. So your intervention was successful, had an impact, but was not sustainable because after 3, 4 years times, the number of accidents rise again, or the number of diseases rise again. So sustainability is another important parameter. I mentioned also that the process evaluation was very important. I will not continue mentioning that because basically you need to evaluate all these elements of your process in the planning or in the action plan and in the evaluation. You need to know in which way you are generating these outcomes, these results, so that you may know how to improve in the future the way in which you are operating. There is another type of action that is very necessary, is the review and continuous improvement. Once we have the results of the evaluation, there is always someone, there are the decision makers, that decides if the program strategy have met the planned goals or not. So the review and the continuous improvement, there are actions that are adopted normally by the national tripartite commissions or by the competent authority on the basis of the evaluation that was provided. They also decide the need for changes changes and what actions will be necessary. They may decide to adjust or they change priorities according to the challenges. Maybe, for example, you have a national program. You implemented the national program. The national program was successful. They achieved their results. But then they say, okay, but we are not continuing this direction because we have new challenges. For example, this is what happened with COVID. I mean, during COVID times, most of in many countries, the priorities on safety and health changed dramatically. So, and this was decided by these decision makers. And to designate new priorities. I want to bring to you a comparison among all these different activities or assessment processes that we have seen. We were talking about monitoring, evaluation, and review. What are the differences among these operations or this type of actions? Monitoring is a continuous process to assess how well the program is working. It's something that we do while we are implementing the plan of actions. The evaluation is periodic or ad hoc studies of the program performance. And it is made when the program has finished, when the interventions, the actions have been finished. Normally, the review is collect the information provided by the evaluation, and it's a decision-making process to assess the program ability to meet the country's needs. They decided, okay, according to the evaluation, we have achieved this and that, and well, we have to decide if this is what we are waiting or if we may decide to change that. So what is the scope of monitoring? Is early warning system to manage eventual deviations. If we are not implementing the activities as we were planning, or we are not producing the results in the right way. Evaluation is an in-depth examination to assess the program performance. How good was the program in doing their job is made after the program has been implemented, and the scope of the review is adjust the program to new challenges and or priorities. What are the main focus of monitoring the process? Is if the program, the national program, is operating as intended. The evaluation, the main focus is to evaluate the results, the outcomes, whether the program has achieved their objectives. But sometimes, most of the times, they also assess the process and assess the impact. The process is assess the process because they need to provide some indications on in which way we can do it better in the future, and also the impact, how much what we have done has an impact in the country. The review, but basically they are interested in the impact. Is how is the impact in our country? In which way what we have done has produced the expected result and has changed in a sustainable manner our country on occupational safety and health. Who do the monitoring? Normally, they're responsible for the implementation of or the management of the program. They are frequently done by the competent authority, ministries of labor or the national tripartite committee that is managing the national program on occupational safety and health. They are the responsible for monitoring, and it's done in an ongoing basis. In the case of evaluations, most of the time, they are experts external to the implementation of the program. So the evaluation is not done for those that are implementing the national program, the activities of the national program, but for external persons, for external institutions, and is done frequently at the end of the national program, or they may decide to have an interim evaluation. We mentioned that in some cases, in the long national programs, there are interim evaluation every 3 years, for example. So this is quite common. And the review is made by the decision makers, typically those that are in the national tripartite committees on occupational safety and health, and are done. This review are done at the end of the national program or at the end of this periodic evaluation review, because when we have periodic evaluations, after these evaluations, normally there is a review from these tripartite committees. I will bring to your attention some of the indicators that have been used in some countries, just to evaluate their objectives. Let me bring to your attention something that we were discussing 3 sessions back. That is, some countries, the national program are mainly focused in activities to strengthen their national program, the adoption of new regulations, or you may decide to develop systems for recording and notification of occupational accidents or diseases, etc., etc. In these cases, well, the evaluations or the assessment of the results are quite simple, because the objective is the production of one particular product. In the indicators that we are going to look at now are, normally there are objectives that are related with reducing the risk factors in the workplaces, reducing the number of accidents, reducing the number of diseases, increase of the number of activities from companies on workers and employers on occupational safety and health, etc. So here we are just having some examples of this kind of objectives. So, for example, when the objectives are reducing the risk factors or improving the health situation, some indicators can be collected from the register of occupational diseases that they have in Denmark, a periodic national survey in which you are asking the people, what are the risks to which you are exposed in your workplace, or what are the health outcomes that you have related with your workplace. So in this national survey, you ask the people how well they feel or what are the risk factors. Or you can also check the people that is sick or under hospital treatment for more related issues. Preventive activities in the enterprises. For example, phone interview with workers and employers, visit in 10% of the companies surveyed. These are the type of indicators that they can have used. Preventive activities of strategy actors, workers and employers, proportion of inspection time spent in priority areas, hospital, research institutes and preventive services that are performing preventive activities. For example, in Australia, they were using this type of indicators. Incidence rate of compensated serious injuries and musculoskeletal disorders claims, numbers of serious injuries and diseases, incidence rate and frequency rates. this in the case of Australia, the national program is a federal program, and the action plans are specific in each one of the provinces. Okay, so when they try to assess the impact at the national or federal level, they have to study the incidence rates in each or frequency rates in each one of the provinces. They use also benchmarking. They compare the number of injury fatality rates or other rates with other countries. Normally, they use it, the best performing countries. Sometimes they use it there as a reference, maybe Singapore, maybe Finland, maybe UK, other countries. And also, for example, here they have indicators to measure the enforcement activity by jurisdiction. Number of interventions, enforcement notices, number of inspectors, number of legal proceedings commenced, number of proceedings resulted in convictions, fines, etc. Some other indicators used are, for example, in some countries, they have as an objective is the reduction of the risk factor and exposures in the workplace. In which way they collect this information? Through self-evaluation of the companies, or you hire an expert that visits some of these companies, or through surveys, labor inspection reports, rates and development of workplace accidents. You can use the statistics. I mean, how many accidents and diseases are reported by companies. So the problem in some countries is the reliability of this kind of data. Same with the occupational diseases and war-related illnesses is most of the times you use the statistics produced on occupational accidents or diseases, data from prevention services and other the social insurance systems, for example. Prevention of the level in the enterprises. Sometimes the labor inspector can provide you information on the rate of enterprises with an acceptable risk assessment, rate of enterprises with a compliant safety and health organization, or other parameters that can be assessed in the workplace. For example, some examples of indicators on the public sector performance on occupational safety and health. Rate of compliant enterprises, rate of enterprises visited by the labor inspectorate, number of types of notifications, improvement notice or prohibition notices. So there are different types of, you can see also indicators regarding the professional competence of all actors. I mean, what type of training have inspectors, safety and health specialists in the companies, representatives of workers on occupational safety and health. So what is the level of education, instruction, or training of these people? And how much of these people we have in our country? Same thing with when we are objectives related with the research. What are the number and quality of institutions that we have in our countries in charge of research, how many projects they have, how much money or what are the budget of these projects on occupational safety and health. So these are some of the information that could be used, the indicators that can be used for that. Here you have an example of, this is in 2005, basically from Denmark, in which they have the following targets. The target was reducing the accidents of 15% from 2000 to 2005. Another target was reducing the exposure to the psychosocial risk 5% from 2000 to 2005. And the third objective was reducing 10% the exposure of employees to monotonous repetitive work. So regarding the first target, they achieved a partial success. In principle, they have 6% more accidents, but they have a reduction of 5% in the serious accidents. So they have 32% more accidents in the first year of employment. It means that many workers are injured or suffer an accident during the first year. So probably they have identified that working with new recruited workers, young workers, has become a priority because there are many workers that suffer in accidents during that period. They identify an increase of accidents in women and in men. These are particularly interesting because frequently men suffer more accidents than women. The main reason is that in general terms, women are in more dangerous sectors and they suffer more and more serious accidents than women. But they have this other situation, and they identify that the increase of the accidents were particularly on some sectors, and they identify the large increase of accidents in home care services, transport, construction, trade of goods, and mason and carpenters. This is a category of worker. So the result of this thing will create a new priorities for in the next cycle of the national program. Regarding the target on psychosocial workload, in which basically they try to reduce the exposure to psychosocial risk, they have also a partial success. Two psychosocial risk factors, high work speed and violence of the at workplace, were worse during this 5 years period. But they have an improvement in the personal development options and clear changes in other parameters like social support, role conflicts, unpredictable planning, low quality of management. All of them, they are psychosocial risk factors that are those that generate stress at work with some physical and mental problems in the workers. Here, well, they have a partial success in these operations. Regarding the third priority, reduce it 10%, 10% fewer workers exposed to monotonous repetitive work. The result was a success. They have a reduction of on the number of people exposed of 10%, and the figures are based on self-reporting of employees. It means that what they did, they of all those workers exposed to repetitive work, they were asked in a survey if they have reduced their exposure or they have in a better conditions. Of course, repetitive work was considered like a permanent fast repetition of movements of fingers, hand, and arm for more than 3/4 of a working day. 6 hours out of 8 should have fast repetition. So these were the results of this analysis that they were made by in Denmark. In Denmark, there happened another interesting thing. In Denmark, there are basically 3 main political parties that from time to time change. One time it is the government, one another. So one of the problems that they have is the interruption of the activities of the National Program on Occupational Safety and Health because it came a political change. So one of the things that it was done, promoted by the workers' organization and employers' organization, is that the 3 political parties agreed and signed a document saying that when a national program on occupational safety and health is being implemented, even if the government changes, the political party commit themselves not changing the political, not changing the national program. So, because in many countries, it's very common that when a new political party comes, they change everything that has been done by the previous political party managing the country. So these 3 political parties agreed that once a national program is decided, budgeted, and planning a number of activities with workers and employers, the new political party will continue with this process, just to avoid interruptions in the national program. The latest slide is on another way in which we can assess how our national program is working or is achieving the results. That is using interview with key informants, key people. So if we have some objectives in which the way to measure them is complicated, or we may have we don't have the generation of of quantitative results. One way in which we can assess the achievement of these goals or objectives is to ask these key informants or key people. Here, for example, you have 3 examples from Australia. This is the opinion of the employer, CEO, the CEO of the Australian Chamber of Commerce and Industry, in which he was asked about his opinion about the National Strategy on Safety and Health. And he said, in principle, the strategy is a success, as for the first time, there is a commitment of all departments to the same goals, and there is an agreed measure of whether or not they are reached. The strategy also helped to improve cooperation, in particular during arguments. It can be used to remind others of their commitment. So just here you have an opinion of the employer, you have an opinion from the trade union from France, etc. So this is a method that can be also used to assess. If you have a look to these opinions of these partners in different national programs in different countries, a very important thing of the national program is that social partners and also professional bodies appreciate very much that those in the government institutions consult, cooperate with them, and discuss with them on how to improve safety and health. Till the point that most of the times the achievement of the objectives is becoming secondary, and they appreciate particularly the fact that government institutions collaborate, cooperate, try to find the way in which improve occupational safety and health. And this is something that is important to take into consideration. So thank you for your attention. Please let me know if you have any questions related with all these issues.
Very explicit presentation, Mr. Felix. Thank you.
Any of you, they have any comment or any question that they would like to share? Okay, let me tell you one thing before giving the floor to Munisa Uematsu to talk to you about the assessment and the evaluation to close the course and to the provision of certificates or of this course. This is the first edition. I mean, in the past, we organized this course in a face-to-face manner in Turin. But this year, we are in the need to increase as much as possible the reach. I mean, to provide this kind of courses or this type of contents to many other people. So we have decided to do it in this distance learning format, and we intend to do replicate this course that has been in English into French, into Spanish, into Portuguese, into Arabic in the coming 6 months or so. So as this is the first edition, is kind of a pilot edition. I mean, in fact, one of the things that I would like to ask you when you do the end of course questionnaire, to provide us any feedback that you may find that could be useful for us to improve this course in other editions, and also to improve this course in the next editions that we intend to do it in next year. One of the main reasons also because in addition of reaching more participants, one of the main reasons for doing this course in this format is also the fact that residential courses here in Turin are becoming a little bit expensive. Not only because of the cost of the course, but also because of the cost of their tickets that have been increased over the time a lot. So we are trying to adopt this as an alternative for these two reasons. But any feedback that you can provide to us, it will be very useful in this regard. Let me tell you also that our colleagues, ILO have colleagues, specialists on occupational safety and health in all the regions, covering many countries. I mean, for example, in the case of you, for example, for those that are in Asia, there are two colleagues. From South Asia, we have Mr. Kawakami. In East Asian Pacific, we have Ms. Yuka Ojita. For example, Penny is in charge of is our colleague from English-speaking countries of Africa. And we have also a colleague, Ms. Varela, that is Sandra Varela, and that is in the office of Port of Spain. So we have safety and health specialists that among their duties and priorities is supporting countries in their processes of adopting national programs, national policies on occupational safety and health, and also on helping member countries in ratifying conventions. Now, the priority of our colleagues is helping countries in the ratification of conventions 155, 187. I'm bringing this to your attention because maybe some of you are involved in these processes of developing a national program, national system, national profile, etc., etc. So keep in mind that our colleagues are there to try to help you in these processes. So some of them have helping me in this program, but just keep in mind that many of them also have let's say duties like advisory duties, so can help you with that. Okay, so if you don't have any question or any comment, I would like just to give the floor to my colleague Muneisa Uematsu regarding the platform and regarding the assessment that is required to complete this course. Please, Muni.
Okay, thank you, Felix. So everybody, so this is the last session for this course, and let me share my screen. Can you see my eCampus? Okay. So let me explain some activities that you are supposed to do before finishing this course. So you can see end of course activities here, and you are supposed to do two things. One is a post-CAT, post-knowledge assessment test, and the other one is a satisfaction questionnaire. The post-CAT is similar to pre-CAT that you took before at the beginning of this course. Post-CAT is not to grade your performance, but this is very important for us to know how effective this course was. So maybe I might have told you that the difference, the score is this is beneficial for us because which means the course was very effective for you, and so please take this post-CAT right after this finishing this course. I mean, maybe this weekend, maybe. And also, I'd like you to complete satisfaction questionnaire. This is what Felix mentioned. This is something that we would like to know what you wanted to do to improve our courses. This is more like not substantial things, but more like logistics things like resource persons, materials, our support, our day. So please tell us your opinions, to be honest. So we are looking forward to your input to improve our future training courses. And I noticed that some of you haven't completed some modules, especially module 4. So regarding module 4, you are supposed to complete module 2. Module 2, Introduction to the National Launch System, and also complete the test module 2. Unless you completed this module 2, you cannot access to module 4. So if you have not completed module 4, please complete module 2 as soon as possible. Okay. And lastly, about the certificate, you will. We are preparing for the certificate, and you will see some section here under the satisfaction questionnaire in this section, end of course activities. And you will be able to download your certificate from here. Okay, just remember this. And if you have any problems or troubles to confirm or download certificates, please let us know. and we will help you. Okay. Any questions? Everything clear?
How soon?
Okay.
How soon can we be able to download the certificates? Beginning from when?
Okay. So we are working from this weekend. So maybe no. From Monday, next Monday, you will be able to download it. Okay.
If you allow Muni, Tesh, we need you to have access to the certificate. You have to complete the postcard and the satisfaction questionnaire. Once you complete that, we will be able to release this certificate that we call digital credentials, because you receive this certificate in an online format. I mean, in a virtual format. You can print it in your end, but we will release to you in a virtual format. So, but first you have to complete the postcard and the satisfaction questionnaire. Of course, to access to the postcard and the satisfaction questionnaire, you should have completed the previous exams of the module 4, etc., etc. So we will keep you, let's say, 1 week more. For those of you that may have to finish these modules, the exams of the module 3 or 4. Because if you don't complete the exams, you cannot access to complete the satisfaction questionnaire or the postcard. And this is required to get the certificate. For those of you that will not complete the postcard or the satisfaction questionnaire in the next week, we will release just a certificate telling you on how many sessions you have attended or how many modules you have completed. For your information, this platform included also all the documentations will be open for for 1 year. So you have 1 year time that you can use or you can access to the materials that are in this platform, included also the videos or whatever, in case you may need to use it in one way. Let me show you that the satisfaction questionnaire, for example, is very simple. There are some questions in which you have to agree or disagree in a different way. And here we are asking you to give us your feedback regarding your opinions or suggestions on how to improve this program as we were asking you to do it. Okay. So
Hi, Felix.
yes, Samatya.
Hi, I am on the page now, but there is no button to start the test, the postcard quiz. It just, the only button there, it says back to the course.
No, don't worry. We will fix it when we finish these sessions. We will fix it, and you will have access to go the pre-camp.
Oh, okay.
Okay. Any other question or comment? Okay, then I would like just from my side to thank you very much for your attention and your participation in all this course. I will always want to thank everybody that has participated as a resource person also in this course, and also to inform you that we are always here. And we have access to a lot of materials and to a lot of documentation. If when you are working, you may need some materials or some issues, please don't hesitate to contact us. Maybe we can find something that could be interesting for you. I already mentioned it, that our ILO colleagues are primarily the people in charge of supporting your institutions in all these issues on safety and health. But privately, you can try to approach us asking for documents or whatever that if we can get it, we will share with you. No problem with that, okay? So nothing else from my side. Maybe Mooney, you want to say something else, or Isa?
I'm fine. I'm fine, but I just show my gratitude. I mean, thank you for attending this course, and looking forward to seeing you in another course in the future. That's from my side. Thank you. Thank you for the active participation.
Thanks from my side as well. Just a reminder that we are here, and if you want to contact me by email or by phone, I'm available, whatever you need. I hope you enjoyed it.
We did.
And I wish you a successful continuation.
Thank you.
Okay. Okay. Good. Then this is the end of these sessions. If you have any problems with the platform with the certificate, don't hesitate to contact us. Okay. Thank you. Thank you very much to all of you for your participation and for your attention in all of our sessions. Thank you.
Thank you so much.
Thank you all. Thank you.
Goodbye. Take care.
Bye bye. See you.
Bye bye. See you.
Thank you.
Thank you.
Thank you.
Thank you, Stephanie, Johannes, Habibur, Mohammed.
Thank you. Thank you, everyone. Thanks
Bye-bye.
for the nice presentation.
Thank you for the course.
Thank you, Stephanie.
Thank you. Thank you very much.
Bye bye.
Bye bye.
Bye. Bye.
Kamal, bye bye.
Bye. Bye.
Sebastian.
Bye.